and I would very strongly recommend you to read the full report by Janice Blackburn. But today I just want to look at three things from that, some key points about what we looked for and what we found, and some consideration about what this might mean. We asked for information from 16 member states for 2 groups of staff. We looked at social workers, which is a relatively small group of staff, usually professionally qualified, graduates, sometimes with a social worker professional title, which is protected. And then we also looked at social care workers, which is a much, much bigger group, usually unqualified, female, lower pay, low status, with little or no recognition and support. And we asked them a key question: is it possible to live on your wage as a social worker or as a social care worker? Is it possible to live on your wage as a single person with no children and without a second wage coming in or benefits from the state? Next slide, please. And we asked other questions too about these groups of workers. For example, what was the profile of the workforce in social work and in social care? How is social care paid for in your country? Does the state pay for all of it or part of it? How does it work? And we wanted to know if the way that social care was paid for actually had an impact on the role and status of social care staff. Next slide, please. And we got replies from 13 states listed here. And we used the widely accepted definition of poverty as an income at or below 60% of the median household income. And this is what we found. Next slide, please. That in 2014 there were just over 23 million workers in the EU categorised as human health and social work in the official statistics, and most of those, just over 13 million, were in fact health workers, doctors, nurses, dentists, healthcare assistants, etc. And the remaining 9.8 million were roughly divided between residential care and a category called social work activities without accommodation, whatever that means. It's, you can put into that what you wish. The workforce is overwhelmingly female. Social workers are much better regarded than social care workers who have a very low status. And very significantly, in almost all the papers we were able to find, social work is largely invisible as a group and is always lumped together in statistics with healthcare workers. And social care is totally invisible. 9.8 invisible workers, unbelievable. And this means, of course, if you put everybody together in one group, that the highest professional status and qualification levels of the medical and healthcare professions actually skews the statistics for this group of workers and masks the very poor conditions of social care workforce. Next slide, please. So looking at financial matters, we found that if you were a social worker, you could live on your pay alone without the need for a second income in all the states except Greece, Bulgaria, Romania and Spain. But if you were a social care worker, the story was very different indeed. Social care workers could only live off their pay in Finland, Belgium, Austria and Ireland. Care staff in all the other countries needed either a second income or help from state benefits to survive. The consequence of this is that we concluded that the majority of social care staff are at risk of being in-work poverty. Finally, on this slide, it was clear that there was a huge variety of ways of delivering social care, and the impact of each model was unclear. Yet again, we found that very little was known about it, even though, of course, it affects an increasing number of people. And if you look at what this might mean, the good news is that social care has a huge job potential creation. In the years from 2008 to 2015, 67% of the new jobs created in this sector came from social work or social care. And this job creation trend is reinforced by EU policies like deinstitutionalisation, support for creating more personalised services, and of course, as we all know, we have an ageing population, so more staff will certainly be needed. In fact, the care sector is a classic EU single market workforce. In this market, staff can move around very easily Entry requirements are low or non-existent in many states. Demand is high and growing. Cross-border flows are significant. But we have to ask the question, are we in danger of creating a huge low-skill, low-pay workforce with permanently low standards? Are we not in grave danger of creating the social care workforce as the exact opposite of all the good things about the future workforce skills and development which previous EU declarations have intended? How can we stop developing what looks like a slow-motion car crash? Because we are in danger of creating a vast pool of poorly paid, poorly trained and poorly managed staff who have few rights, little job security, low job status, unable to live on their own salary and either needing a second job or state benefits to survive. This will happen, in fact it is already happening now, unless we try to do something about it. Slide 9, please. So what can we do about it? Well, firstly, the Parliament or the Commission, or both of them together, could find out what is really happening across all the member states, not just the 13 that we looked at. What we have here is a tiny piece of research, but it has uncovered a significant level of ignorance about a large and growing sector of the EU workforce. You can't fix a problem if you don't know about it. Secondly, we must try to do something about minimum standards in care work. This will not be a quick or easy fix, but there are some existing tools which can be used to good effect if there is a will to do so. There's a very clear disconnect here in that we clearly understand in the EU about the specifications, for example, of electric motors in every vacuum cleaner that we sell in the EU. But apparently at the moment we condone the hiring of anyone to look after old and vulnerable people without any recommendations even, or qualifications or quality marks to assist the employers, who may be families of course, in their hunt for good staff. Thirdly, the European Pillar of Social Rights could be used as a way of improving and supporting the status of social work and social care staff. And finally, the EU hands out structural funds. We must make sure that these funds are used to modernise services and not to perpetuate old institutions and old care practices based on the outdated medical model of care. Slide 10, please. I think there's also a major equality issue here. Both social care and social work are overwhelmingly female professions. Is there a danger that this leads to what they do being undervalued as just being women's work? The care sector exemplifies all the old gaps in Europe writ large. We are looking at, in general terms, at the old divide between male managers and female workers, the gaps between poor and rich countries leading to net importers and exporters of staff in social care. In the social workforce army, there are a few qualified generals and officers, but the frontline infantry do all the work but get no training, and they have little or no job security. So, final slide, please. So here is an idea, it's a challenge if you like, which could only improve matters. The future for the social care workforce could be a test bed for demonstrating how the EU can, by acting together, protect vulnerable people, raise standards in the sector by providing at least a minimum qualification. It could protect workers' rights and promote higher standards of health and safety by being explicit about what all staff should know and be able to do, and the support that they should get. In other words, it could, if we wanted to, it could come to exemplify the best of what the single market is all about. Or it could come to exemplify the very worst aspects of the single market, with a drive to the bottom on pay and prospects and protection and professionalism, and we can continue